Thank you very much. As you may have noticed in some of our previous information, this is the entire title of the program, From Dream to Reality. And you might wonder why we chose this. It's because every time I meet people who haven't seen me for a while, they ask, so where is healthcare social media? Are we still in all of this hope that's being announced, or is it really going any further? The idea being that they probably won't believe me and then I'm going to start justifying it. And so that made me want to think about the fact that, yes, there is a reality. And that reality, though, is within a dream. And dream starts with D, and Denise starts with D. And we wouldn't be here if Denise hadn't had some dreams earlier in her life. Because I actually grew up in New York. And if I hadn't early on wanted to come work in Paris, and for a sort of family traditional reasons wanted to work in healthcare, and if I hadn't had those dreams and make it happen, and it wasn't easy, we wouldn't all be here together. So when people are saying, well, is it going to ever get out of the dream stage and into reality? The fact is you really need both. You need dreams and reality, because the reality, yes, is not so perfect. When I got into healthcare, I started noticing that there wasn't everywhere the quality of care that you would hope. And I felt that at the basis, the issue is the physician-patient relationship, which isn't as ideal as it could be, even with the same technical limitations. And then, in my life, personally, along came the internet in 1994, and I thought that this was going to bring very quickly a whole series of solutions. But in fact, it's always been controversial from any number of standpoints, whether legal, psychological, society. The internet has never been able to come through in 100%. And one of the problems is that people have continued to work and live and breathe in their silos. They can't do this because they're in a private company. They can't do that because they're a physician. They can't do this because they're a patient. They're within a national boundary. There might be economic limitations. There are always limitations. And when I went to conferences, and quite often I was invited to speak as I was the only person coming from France to a conference, and there weren't many Europeans even there. I felt that all of this is wrong, and that I wanted to put together, this became my dream, to put together a conference and actually a movement that would be patients included, so a big effort to bring more patients to this sort of gathering, that would be global, and we have people here today from almost every continent, that would bring together private and public, neither one saying that the other is to be excluded, that would have at its basis to create the better relationship between physician and patient as partners, and that would be content. All year long there is content put up on the site, as this picture shows. And so that dream became a reality with the idea that it would be called Doctors 2.0 and You, which means everyone, and that it would take place in lovely Paris, which is such an attractive city, whether for the people here or the people who come to visit. And thanks to this series of ideas and hopes, our network has been growing around the world. Some doctor in Singapore sent somebody else that I didn't know. So it's really fantastic in that way. And I'd like to remind us of the progress we have made, because in 2011, we did a manifesto, and many of you in the room helped a lot with that, where for the first time we really said that there's an issue of the doctor and patient not being able to have the discussion that they need. And then the year after, it seemed appropriate to present to people, what do we mean when we say social, local, global mobile gamification and big data, which was Solo Glomo Gabi. Now you don't need me to define those because the people that are here have been reading about that, talking about that all year long. So that's another way of seeing the progress. And for this year, we want to talk about refining, about making that collaboration even stronger in every way possible. And so I decided to tell you what I've been seeing that has happened very concretely in reality, but still within the dream of healthcare social media for the past year. And the first thing, and I don't know if you'll agree with me, you'll let us know by the tweets, haha, is the fact that this is the year of Twitter, that Twitter in healthcare has really made a huge leap forward. And how can we explain that? Well, by noting that instead of saying that it's Google predicting flu outbreaks, a study has been shown that Twitter itself can predict outbreaks. We're very happy for the work with SIlber about our hashtag, showing us that last year there were 5,000 tweets, and I'm sure we're going to break that this year with nearly 12 million impressions. If this conference weren't of interest, then people wouldn't be retweeting. We have with us Lisa Bernstein, who is one of the patient scholars, and I love this tweet from a doctor to her asking about side effects. So you can see here the great interest and impact that Twitter can have in giving a floor to patients to talk about the real life experience with a drug. And we did some work last year about French physicians on Twitter, which we further analyzed. We saw that a very small number of French physicians are on Twitter. That's 385, but there are more who are unidentified than identified. So 219 are presumed versus identified physicians, and that they have a different behavior. They tweet more. When they're unidentified, they do 8 tweets a day versus 3, and they are more likely to present jokes about patients. And I found this wonderful quote, and I see people smiling in the audience. That's very pleasant to me. I know that I myself am going to get attacked on my personal hashtag for saying this internationally, but I found a quote which is for any physician out there, that publicly posting a status update to release frustrations in such a way that makes fun of a patient connection is just not acceptable. And this is one of my favorites. I hope Larry Chu is with us. So last year, during the film, somebody from Vidium tweeted about the film, and somebody else watched it in New York. It took 6 months for me to find out that that person who thought they had been suffering from Crohn's disease actually was allergic to gluten. Their physician had said it couldn't be that. This person took it upon herself to stop the gluten, and within 2 weeks was cured of what had been for, I believe, 18 months, leading her to the point of wanting to resign from her work. So this happened thanks to the conference. And so the second point is that this has been the year of visualization, an easy transition from Twitter. Twitter leads to a lot of visualization. And interestingly enough, this question in an infographic was about how does perception match up with reality? Independently of the quality of a healthcare system, people have different feelings about whether they're being properly taken care of. And so last year, we showed IDOC24, who was one of the finalists for the contest, about how they have a dermatology evaluation. We showed the Synapse software, which we'll be talking about later, that also visualizes a diary. There is another diary for inciting patients being done by Health for America. We'll be talking about the fork that has another way of visualizing meals and their speed, the digital fork. SIlber has done a lot of work in visualizing patient communities, and we see here dots representing physicians and patients and tweets. You'll be hearing about Google Glass from Dr. Grossman and how this enhances reality. It is also the year of certified app evaluation. We're stopping the hype about apps and saying that they need to be evaluated. Given the huge number of apps that are being downloaded, this is very important, and I believe that this is the first conference that is really talking about that. And there is a group of hospitals in New York that put together a app evaluation certification program. There's a company here that participated in the contest, DMD Santé, that also is evaluating apps, and I'm sure there are many others around the world. The NHS is proposing pre-evaluated apps to patients, and we'll be talking about that to improve the physician-patient relationship, the idea being prescribable apps. Community is being redefined as we speak. That's another important point. And in 2011, when Cancer Contribution was named as our cause of the year, they launched a platform that now shows that multiple healthcare stakeholders can work together and bring improvement to cancer. Even Ikaye, who's 2012, has a community that started as a blog, that went to a website, became an association, is now on Facebook, and for the past year has been affecting policy for kidney transplant in France. We have a number of other kinds of communities, such as Gilles Friedman's Smart Patients, created with Ronnie Zeiger from Google. We are delighted to have with us the epilepsy community from Patients Like Me research person, whom I'll mention again in a minute. For 2013, we've chosen a Twitter community that is being launched called FRDoc, that's being launched with a number of other diabetes online communities. The company World One Sermo, through Doc Tango, has created a serious game community because doctors like to be challenged with respect to other colleagues. And so that is yet another kind of community that we can be seeing. So 2013 is really a year of a new kind of community. And we'll be hearing from DermaWeb, where for the first time, the company who publishes this, Pierre Fabre, has added a community side to what was originally not that way for their dermatologists. And it's also been, and thankfully, because all of this requires means, I've also remarked that this has been a year of investment with last year's company called Lastari that has received a significant investment this year for their instant pharmacies where people go in and have telemedicine at their disposal. World One Sermo that I just mentioned, $35 million. People are noting from the field that digital health is not a bubble, that there's more good things coming to it. So significant amounts of money. We had more startups requesting to be in the contest than ever before and had to turn away many, so we wound up with 12. And one of our startups very recently received a significant contribution. I would say that this amount is very significant in Europe. It's been the year of diabetes, with the fact that somebody has evaluated and discovered that diabetes is the most represented mobile app in the App Store. And it's in keeping with that we've been talking to you last year in this so much about diabetes with Endogoddess and IBG Star last year, and Diabeo and My Sugar this year. And it's always the year of people. It's not about just being virtual, it's about real people. And I'd really like to salute all the doctors here who have invented tools. That has been yet another discovery that we've made, this incredible number of doctors inventing tools, such as using Pinterest, creating websites for patients, Ronan himself using video, and he'll be talking about that, and Dr. Grossman. As well as Dr. Hickson, who's in the audience, with his Patients Like Me epilepsy community. And patients with diabetes could also be patients with dreams. That's what I've been telling them. And we're extremely excited that we've had these people here with us for the 2 days, working with us to explain about all the dreams and realities of patients with diabetes, so that we find ourselves all amongst the speakers, myself very happy that my dream has become a reality in Paris, and that if we hadn't done this in Paris, I wouldn't be able to remind you that we wouldn't probably be here if Gustave Eiffel hadn't had in his time a dream to do something that was considered technologically impossible. Thank you.